Gynecologist, what's the most horrifying thing you've ever seen? Gynecologist here. Sometimes I come across unpleasant cases where a girl has been walking around for days/weeks with the same tampon. Necrotic vaginal cancer doesn't look great either, but even that doesn't come close to the worst case of my life. One day, a 19-year-old girl came to our clinic and complained that a hairspray cap was stuck in her vagina. Well, that's not a problem, I thought naively. But the catch was that she had put it there when she was 15 years old. That is, 4 years earlier. She didn't explain why she had done it, but it was obvious that she was very ashamed. Even before she undressed, you could smell an absolutely horrific odor, which became much worse when I started examining the problem. The cap had been inserted with the open end facing upward, and it was clear that over the course of 4 years, it had become heavily overgrown with vaginal tissue. Removing it was made even more difficult because the cap had perforated her bladder and rectum. It took several extensive surgeries to remove it. I'm not a gynecologist, but I know someone who recently had a hysterectomy, removal of the uterus. Basically, she had stitches in her vagina that needed time to heal, but she was so eager to get back to having sex that she couldn't wait and ended up tearing them open. As a result, part of her small intestine protruded through her vagina. The whole story was described to me in such graphic detail that I don't think I'll ever be able to eat ground meat again. According to her, while she was on her way to emergency surgery, she could feel her intestine resting on her leg and pulsing. I had a friend in high school who was terrified of going to the gynecologist. When she finally worked up the courage to go for her first pap smear, she got so nervous that she clamped the doctor's legs between hers like a vice. According to her, it took a while before she was able to relax enough to let the doctor go. It was incredibly embarrassing. She laughs about it now, of course, but her shyness about her reproductive organs has never really gone away. She doesn't even like using tampons. I'm a medical student. Once I signed up to assist during a hysterectomy. On our way to the operating room, we were told that the patient had a small ovarian cancer, but it turned out to be much worse. Her entire abdominal cavity was riddled with metastases, so we spent 13 hours just reducing the tumor burden. The whole operation was supposed to take only about 3 hours. At certain stages, we were assisted by colleagues from general surgery and vascular surgery. We ended up replacing about half of the patient's blood volume. After everything she had been through, she was in very poor condition and had a long, difficult post-operative recovery. But in the end, she pulled through and was able to return home to her family. It was an incredibly exhausting case for all of us, but both the patient and her family were wonderful people, and it was an honor to be able to help them. Woo! I'm not a gynecologist, but I do perform pelvic exams from time to time. Once, I removed a tampon that had been left inside for at least a month. The most surprising part was that the woman had been sexually active the entire time. The smell was absolutely horrific. After she left, it took several hours to air out the room. We spent that time wandering around the clinic, trying not to throw up. My dad once told me about a woman who had a severe heroin addiction. For some inexplicable reason, she decided to get creative one day and injected herself in the labia. It resulted in gangrene. I'd say it definitely wasn't worth it. A bit late to the thread, but here goes. I'm a medical student, and in a few weeks, I'll officially become a doctor. Not exactly a gynecologist, though. During my OB/GYN rotation, I was assigned to examine a young woman. As I was getting ready for the exam, the smell in the room was so overwhelming that I started thinking I was about to see the worst case of bacterial vaginosis I'd ever encountered. I began the examination, looking carefully, but I couldn't find any unusual discharge. Strange. Then I started leaning back and realized that the farther away I moved, the stronger the smell became. It turned out her feet just smelled absolutely awful. I highly recommend reading Dr. Lissa Rankin's book, What's Up Down There. There's a section where she describes some of the most shocking cases from her career. For example, she writes about finding maggots, money, and other objects. But those are just the warm-up stories. The wildest case involved a woman who had a potato growing in her vagina. Basically, she had decided to use a potato as a form of contraception. And since potatoes thrive in warm, dark, and moist environments, it started to sprout. Eventually, potato shoots were sticking out of her vagina. My story isn't about vaginas, it's about breasts. But it's no less disgusting. When I was in high school, I joined a student program that placed students in healthcare settings for hands-on experience. I chose to help out in the emergency department. One day, an extremely obese woman was brought in. Her chief complaint was breast pain. Everyone could tell there was a truly horrific smell coming from her. So the doctor decided she needed to be cleaned up and examined. He washed the area, lifted one of her breasts, and the stench that came from underneath was so overpowering that we all nearly passed out. Beneath the breast was a colorless crust-like layer. The doctor cleaned it away. The crust came off, revealing a small hole, and cockroaches started crawling out of it. The most likely explanation was that eggs had been laid in the skin fold beneath her breast, and when they hatched, the cockroaches couldn't find a way out, so they had to chew their way to the surface. I'm not a gynecologist, but I've also seen some pretty intense stuff. 1. I saw a woman with vaginal cancer. Later, I saw what happened to her after a full removal of the vagina and cervix. It wasn't a pleasant sight. I can't describe all the procedures in detail because I was still a very young student at the time. But in the end, all that remained of the former organs was a large hollow cavity from which something was leaking. The poor woman was so devastated that she begged her husband to leave her, saying, and I quote, "After this, you will never be able to love me." But he turned out to be a great guy. He stayed by her bedside the whole time, held her hand, comforted her, and supported her with love. You could see he truly adored her. 2. We admitted a 220-kilogram woman with paralysis of the lower limbs. She had a giant ulcer and necrotizing fasciitis that destroyed everything in the genital and gluteal area. There were erosions in the rectum. We knew this because fecal matter was leaking from several damaged areas. When the doctors asked us to collect a urine sample, it turned out there was essentially no bladder anymore, and no vagina either. It was decided to try to somehow patch up the wound. 6 of us barely managed to roll her onto her side and basically started stuffing a bunch of gauze into the giant cavity, hoping she wouldn't defecate during the procedure. She died very quickly. In such cases, we are powerless.